Dr. Sarah Levin, a cardiologist with HealthQuest The Heart Center, wants to remind you February is National Heart Health Month. Cardiovascular disease is one of the biggest issues that most Americans will face. In fact, 1 in 4 deaths is attributable to cardiovascular disease.
But over 50% of people will be affected by it, either suffering from an MI or stroke or some other form of cardiovascular illness. Conquering cardiovascular disease is a two-pronged approach. It's lifestyle interventions on the part of the patient, and it's medical interventions that are done in conjunction between the patient and the doctor as a team.
And the human heart is the engine that runs our body, and we've become a country of fast food addicts. More than 1/3 of Americans are overweight or obese, increasing life-threatening high rates of heart disease with every bite of fast food. So Dr. Levin says we can make simple changes that reduce our family's risk of heart disease.
You make the most important decision in your life 3 times a day, and that is, what do you eat? Focusing on healthy fruits, vegetables, natural whole grains, things that have been less processed. Particularly in the Hudson Valley, we're very lucky to have access to a lot of great local produce. Avoiding added sugars, saturated fats, and unhealthy fats, all of those things. And it's hard. You know, people are busy. It's not always easy to go to the store and get tons of fresh veggies. It's not always easy to prepare healthy meals when you're working. So there's a lot of emphasis during this month and hopefully all year round about trying to help people find ways to make healthy choices.
And it's all about going the distance for a healthier heart.
Exercise is a huge piece of this. As you know, particularly in the weather we're having right now, it's hard to get out and exercise. But maintaining a good level of activity throughout the year is very important, not just for cardiovascular health, but for your well-being in general. Everybody gets a little stir-crazy in the wintertime. The technical recommendation is for about 150 minutes of moderate aerobic exercise a week. I try to encourage people to work something into their program every day. It's hardest to get into a regimen, but once you get into the swing of it, it's much easier to sustain it. You don't have to reinvent the wheel, you don't have to run a marathon, you don't have to spend $1 million on a machine. Anything you do that gets you moving and doing more than you were doing before is good.
And there's even an app for that. There's lots of applications that you can download on your iPhone or your Android. And the best part is they're free. So now's the time to take charge of your cardiovascular health. Reporting for HVNN.com, I'm Donna Ryer.